A warm welcome, dear viewers, to the Swiss Health Television. Today I have two remarkable doctors as my guests, Dr. Harald Burgard and Dr. Torsten Diesinger. And with them, I will discuss the holobiont concept and toxopheresis. I'm looking forward to the conversation because both of their works encompass a holistic approach. And it's incredible what possibilities there are for people who might suffer from chronic illnesses or multiple stressors. And I hope you will follow us into the conversation. Hello, dear Harald.
Hello, Silvia. Good morning.
Hello, dear Torsten.
Hello, Silvia.
It's wonderful to have you here today, and I was already very excited during the preliminary discussion. I almost couldn't stop because I had so many questions. For me, this is truly holistic medicine in every sense of the word. But before we start, I also want to know how you came to this collaboration.
Yes, we can already call ourselves that. And I have been practicing holistic medicine for over 20 years. And it's just very, very important that many people benefit from it. And that's why it was important to us as MedSelect, which is a collaboration that I am involved in which many doctors are now involved, to pass on a concept where we simply conduct a comprehensive diagnostic process, where we perform an effective therapy, where we can truly detoxify people in a way that shows excellent results. And that's why it was important to me to introduce such cooperation partners, who then introduce themselves, all of whom are excellent specialists who have the competence to do all these things that I have been talking about for a long time. And Dr. Diesinger is a biochemist and a specialist in internal medicine, and will simply introduce himself today, present his practice, share his experience, and how he deals with toxopheresis.
Wonderful. Thank you very much, Harald. I will say goodbye to you at this point.
Yes.
And I'm looking forward to the conversation. Dear Torsten, I'm very glad that you are here. This is your first time at our station, and perhaps it's interesting to hear a little about how you work. Do you work in practice, in the hospital? How did you even come to this plasmapheresis and holistic work?
Yes, very gladly. Thank you very much for the invitation.
You're welcome.
Dr. Burgard has already made a nice introduction. This is a career path. In the end, it was such that during my specialist training as an internist, I had to realize that I couldn't really help most people in any truly effective way. Chronic patients who keep coming back and are usually in worse condition on repeated visits. Despite the medicine, the modern medicine, which we applied daily, it was unsatisfying. After my specialist training, I set up my own practice in the field of general medical care, and the situation wasn't any different there. And so I had to keep asking myself whether I was doing what I do sufficiently well, efficiently, and effectively, and I had to answer with no. And so I embarked on a journey, informed myself, continued my education every day and on weekends, and ultimately came to environmental medicine, and the realization that a healthy person can't really exist in a sick environment. So in this respect, we cannot wait to change the environment, but we must see if we can manage the environmental burden we are exposed to daily, in some form, medically. After many attempts, including therapeutic attempts, one ultimately comes across therapeutic apheresis. And a special form of therapeutic apheresis is toxopheresis.
You are looking for videos for a specific topic? Then let iSauna generate the most relevant content to your search query.
And I am now very glad that I can apply this procedure by myself.
Wonderful. And as I already know from Harald, it is really a very holistic approach here, looking at everything, many parameters. Perhaps you can say what happens when someone comes to you, maybe with a chronic illness, a chronic problem. What is the first step? How is this diagnosis? How is the treatment?
Yes. So when someone comes to me suffering from a chronic illness, whether it is in the field of the cardiovascular diseases, such as high blood pressure, arteriosclerosis, have already had a stroke, had a heart attack, diabetes, but also neurodegenerative diseases, multiple sclerosis, also Alzheimer's, then first of all there is a very long conversation. You have to gather information about this patient, and this is the first thing that patients also report back, that this was actually the first time in their long medical history that a therapist took the time. As a result, most patients have already filled out a comprehensive questionnaire, where I inquire about many details that may seem off-putting at first or unusual. How does the patient live? How have they lived? Where do they live? Are there telephone masts nearby? And so on and so forth. What diseases are present in the family? That is the very first thing. And then, based on that, a comprehensive diagnosis follows, particularly a comprehensive lab diagnosis.
So when you say it like that, then it is simply wonderful and touches me deeply, because in today's hectic times, where sometimes you only have 15 minutes for a patient with statutory health insurance, it is simply wonderful for people who really have years of medical histories behind them, in every way. And if now, what happens perhaps in toxopheresis, for people who haven't seen other programs yet, that they get a small idea of what it actually is?
So before I go into toxopheresis, I would like to take a step back briefly. Because toxopheresis, or therapeutic apheresis, is an essential component in the treatment concept, namely to eliminate harmful substances from the body. But that is only one aspect, which I will return to shortly. The other aspect is to look at this holistic method to see what other burdens are present or what deficiencies are present. So quite trivially, is the body sufficiently supplied with micronutrients? Or are there chronic infectious diseases that are not detected at all by normal blood tests? How is the intestinal health? Crucially important, the focus of public interest is increasingly on microbiome analysis. But the consequences arising from this are very diverse in nature. So without a healthy gut, the organism actually cannot heal, no matter where the disease is. Whether it's a dementia disease, whether it's diabetes, a metabolic disease, and that always has to be part of the diagnostics, and it always has to be treated. Otherwise, we won't have a decisive success in toxopheresis. Toxopheresis currently guarantees as the most modern method in medicine to remove environmental pollutants, circulating autoantibodies, cytokines from the plasma.
Wonderful. It is actually why for so many different diseases, it's a foundation for the body to regenerate itself and regain its healing power. Do I understand this correctly?
Absolutely. It is actually a very special and highly effective form of regulation medicine that is being applied.
Very nice. And you said that micronutrients, like that's already taken as a basic. And I must unfortunately say, I very often experience that it's not taken into account and barely considered. It is so essential to look at all parameters. And what I also find very great, as you mentioned, in the inquiry, to also look at how a patient lives. If someone perhaps lives in an old house with lead pipes and has lead poisoning, then of course it's no good if you don't look into that. And that is really very rare. For me, this is the future model of holistic medicine. And I think that's really nice. Do you have in your general practice a focus on diseases? Or do you always look at every patient holistically and check depending on what's necessary, whether toxopheresis is appropriate? Or, of course, also another treatment method? Or are you specialized now in this area?
I'm not specialized in the field of toxopheresis. That is an essential treatment concept for me. Even before the patient comes for toxopheresis, or I recommend it to them, several steps have already been taken. It is a method that is virtually reserved, depending on the situation, when you cannot make progress therapeutically in other ways. In principle, I do not limit myself to any specific indication areas. This means patients come to me who are neurologically at a dead end, or patients who are not cardiovascular, no longer have hope, who are dependent on insulin, and determine that an illness of the next follows because the treatment concept is highly individual.
Maybe we can also elaborate a little on what comes out of the blood at all. I think many people are not aware of everything we are burdened with.
One has to imagine it like this. Currently, around 350,000 chemicals are made by humans in the environment. They cannot be removed either. They are there. We have to deal with them every day. The tendency is clearly increasing. This means what toxopheresis essentially does is attempt to remove exactly these chemicals again. We can see that too. One essential point, and I believe this is where we differentiate ourselves from other methods, is that we work in a scientifically based manner. This means that what we filter out of the plasma, the effluent, is also analyzed. By now, there is the possibility to analyze 1,000 different substances in a specialized laboratory, which is certainly leading in this area. These are pollutants, all toxins that either have a carcinogenic effect, i.e. are carcinogenic, endocrine disrupting, i.e. act like hormones, damaging, affecting fetuses. All of this can be analyzed. We have limited ourselves to 60, and so far, we see a massive burden in every patient. So the goal would actually be for none of these substances to be detected in the effluent, but the opposite is the case.
Very impressive. And this once again shows what our body has to bypass everything and still does it so wonderfully. And any help for our system would be advisable. And I know also from the films with Harald, that he really, even with people who searched desperately for years and were also not quite, simply considered beyond treatment, then truly wonderful successes could be achieved. Have you also experienced it like that?
Yes, that's the norm. So I haven't met any patient who after this procedure said it had no positive effect on their well-being. I must say, it is highly individual, depending on how long the illness has been there, how complex the disease is, and how many diseases there are. Different therapy sessions are necessary. So one cannot say beforehand that 2 are enough. Maybe it's 10. Yes, one doesn't know. What one does notice is that when the first therapy session is over, the body has, for the first time, possibly in decades, the possibility to release the pollutants from the tissue back into the blood. And that's why the second therapy session must be done relatively quickly, typically within 48 hours. After the second session, you generally experience a significant improvement, regardless of the patient's symptoms.
So what you're saying is incredibly promising. In my own environment, I know many people who are really desperate because they just don't have any strength left, are exhausted. Yes, as you already said, one illness and symptom chases another, and one simply cannot grasp it. And unfortunately, I often witness that people are dismissed as mentally ill or psychosomatic. That perhaps also in this area, with people with psychiatric problems, one should perhaps look closer and maybe also exclude that something so fundamental is underlying, right?
Yes, absolutely. Mental illnesses or behavioral alterations result in, I would almost say rather in the subordinate case, endogenous, meaning that it comes from itself. So what absolutely must be rejected are chronic infectious diseases, such as Lyme disease or other intracellular parasites that cannot be detected through conventional laboratory diagnostics. However, there are very modern laboratory diagnostics to see if a patient is burdened and also if co-infections exist. All of this affects the psyche. Poisoning with toxic metals like lead, mercury, all of these play a very central role, but also micronutrient deficiencies, so quite trivial, actually. And such things always belong in this overall concept. This must be considered, this must be treated. In connection with toxopheresis, I would say that there is already a tool in hand or a concept that truly provides improvement for patients who were considered fully treated. Also concerning mental illnesses, autism.
Wonderful. Very hopeful. That is such a broad field, but it's nice that we can really open up the range for people and that one can understand how it really works and what it's about. And really a lot of hope, as I already said. Would you then say, in today's time, for example, if a young couple wants to decide on having children, would it be sensible to check in advance how burdened I am? And then maybe before a pregnancy also to detoxify and create a good foundation. Because you detoxify a child, don't you?
That is a very, very important question, which actually hasn't been the focus medically at all so far. Absolutely, that's my answer, absolutely. Especially if there is a desire for children, or especially if it's not working out to fulfill this desire for children, one should take exactly this step to ask, why is that so? It's rarely, or in the most unusual cases, really the woman or the man, but rather the metabolic situation. And to maximally protect the unborn child, treatment would be absolutely sensible and also ethically good.
Very important. And if now young couples are watching and think, aha, this is a possibility, what would that look like? Do you know how long the body takes so that it does not detoxify into the child? That is, of course, very individual. But let's say people who are, like we all actually normally unfortunately burdened and do such a toxopheresis, how long must one wait to decide? Can you even say that?
So now, in this special case, if it concerns young people who are healthy, mother and father, then 2 apheresis units are also sufficient. And I think there is really a sustainable effect there. It's not just patients who are chronically ill who come, but there are also patients who want to stay healthy. So what I can remove today with apheresis won't make me sick tomorrow. And especially people who are really under a lot of stress, professionally, privately, or also people who are self-employed, who say, I must not get sick. They naturally think about how it will look in 5 years, in 10 years. Will I still have the health to run the company, or to take care of my family? And they come too. They have no symptoms, they are still healthy, and they also benefit from it.
You have already inspired me. Before the show, I really thought about it too, because it just makes sense, because we are all burdened and we feel subjectively good, but we don't know what our body has to accomplish every day to deal with these things. I also find that an important piece of information. I really believe in the future that we will, more simply, having things in mind and also relieving us in this regard. And what would you recommend now, or what is your experience when people are healthy and just want to detoxify every now and then? Does it have to be repeated now and then, or is that naturally very individual again? But what would you recommend?
Definitely repeat. Why? Because we don't change the environment, at least not within a few years. And it's also irrelevant what the environmental conditions are in Switzerland or Austria or Germany, because by now it's a global issue. In the bioassays we analyze, we see components that have been banned in Europe for 30 years, but they are still in us. And it shows that this burden, we can't escape these burdens, but what we can do is strengthen our own health in order to deal with these burdens. And that is by making sure that our micronutrient balance is equalized, that the substances that harm our bodies are eliminated, and that we tackle chronic infections. That is the directive.
Wonderful. Now I have one more question. Did I understand that correctly? Exactly. Also, when we are contaminated now, that means with environmental toxins, heavy metals, whatever, that our immune system is actually in a permanent overload, constantly having to react. And that's why we might have less resistance to viral or other pathogens. So does it correspond having a higher burden with other pathogens because our immune system is occupied otherwise?
Absolutely. So we are not only burdened with environmental pollutants of a chemical nature, but also with pathogens. That's quite normal. But when we are healthy, we can keep these pathogens at bay. So we can manage these pathogens with our immune system. That is like with the herpes virus or with the Epstein-Barr virus. We only get sick from it when something happens with our health that is not good. When we have had stress of a psychological nature, of a physical nature, then we suddenly get herpes or we get shingles. And that is the same with other pathogens as well. It's like when the cat is away, the mice dance on the table. The toxopheresis does nothing but relieve the immune system again. And then the immune system regenerates increasingly by itself.
I have another question. If now doctors are watching and thinking, yes, I feel the same way. I have many patients whom I simply cannot do justice to. And if they now want to join in, is it possible for them to work according to this holobiont concept?
Yes, basically yes. Of course it is open to everyone.
Is there a prerequisite? I ask like this. Is that a requirement? Do you have to be an environmental doctor? Or could anyone get fit with this concept?
That's up to each individual. So the information regarding the holobiont concept is freely available.
Wonderful.
That's important too. We work transparently. We also work scientifically. That's the guideline. And that's why this information is available to everyone who is interested.
Wonderful. I am really very touched by this holistic aspect and its complexity. Now you also understand why so many different clinical pictures can be sensibly supported or even treated with the same method. And have we forgotten any important point before we close? Because it's such a big field, and maybe you have something else that you think, yes, that would still be information for the people.
Yes, the information for the viewers is don't wait too long with prevention. Don't wait until the symptoms are there, until the diseases are there. Start thinking about your health beforehand and try to age healthily.
Such a nice closing statement. I feel the same way because aging is often associated with so much. One often has the image of illness and feeling unable. But maybe it's the sum of all the burdens over the decades and lifestyle, and that we can change something at any time, even if we are already older. I find that a very important message. Yes, Torsten, it was so exciting, and really it always touches me personally a lot when doctors set out on the path, really search for methods to truly support people. I find that quite remarkable. And I'm sure many viewers would like to delve deeper into this or find you. Where can one do that?
So I have my practice at Ulm, 2 practices, one in Senden, one in Steig. You can reach me on the internet, you can find me, and you can reach me at the web address drdiesinger.de.
Im Internet finden Sie mich und Sie erreichen mich unter der Webadresse drdiesinger zusammengeschrieben.de.
Wonderful. Many thanks, Torsten, for taking the journey to us.
I thank you, Silvia, for the invitation. I really enjoyed it.
Gladly. Dear viewers, such an important conversation, such a wonderful doctor. And I think for all of us, it is simply very important to take responsibility and look after our health. We have received many important suggestions. I hope you will join us again next time. Stay healthy, and goodbye.
Thank you for watching on Swiss Health Television QS24. Please also visit us here on Wikisana. All shows compiled for you ad-free. And here below we have the button to YouTube, our channel. Please subscribe to it too. And here, a selection for you, compiled of interesting broadcasts. All the best, until another time. Goodbye, everyone.